Latinos face many barriers to healthcare. In Benton County, Oregon, health and school officials added a navigator to build health equity and help families in a central location, schools.
A lot of our families, because they don't have health insurance, because they don't qualify for health insurance, and that has a huge impact, indirect impact in their ability to be healthy.
We have a lot of families that when a student needs something extra, we may be able to identify it, but we would come into a lot of barriers on how to help them and how to help that student, and we didn't have anyone that could really follow through and work with the family so that they're feeling comfortable.
How could they guide parents and kids to better health? They looked at a nearby school welcome center, which created a central contact point for Latino families for academic support.
Families really wanted to have this welcome center concept where families could go and access services, not just for the student, but for their entire family. Just started thinking about ways that we could embed a community health worker or a community health navigator within the schools.
County and school officials planned a school navigator project. The county would pay for bicultural navigators to embed in schools. Schools would give navigators support, offices, and access to student screening records.
We act as cultural brokers. We are the bridge between the agencies and the parents, being able to access the services. We work with the schools to identify which children need immunizations, and we work with the parents so they make sure that they're connected to the services.
We do health screenings here at school, but a lot of times there is a ton of follow-up that needs to happen. We can identify, we need to look into hearing, or we need to look into vision, or a number of other things. Our health navigators follow up on all of that and follow through with families and make sure that they get whatever assistance they need.
The School Navigator Project embedded navigators at 2 schools in 2014 to 2015, including Muñoz at Garfield Elementary. Her services, including help signing up for and understanding health insurance and related benefits, were so popular, she would arrive to work and find 4 or 5 mothers lined up at 8:15 a.m. with health and other paperwork in their hands.
Yo estoy muy agradecida con el programa porque me ayudó con lo de mi hijo, y yo no puedo decir, o a lo mejor sí puedo decir que gracias a eso mi hijo se salvó. Mi hijo se salvó porque todo fue más rápido. Ellos como navegadores que son, te buscan, luego te buscan opciones a veces de lo que necesites.
Que gracias me ha ayudado mucho, y por ese programa ella me ayudó a salir del hospital.
Due to initial success, 3 navigators will be embedded in schools for 2015 to 2016. And Muñoz takes on a new role of providing technical and other assistance.
So the School Navigator Project really is addressing health equity, because if we think about the language barriers, the cultural barriers, the knowing or not knowing how to access services, we're not treating everybody the same. We are giving enough, or we are providing enough for everybody to live the same.